Good morning, and thank you for joining us this morning for Ask the Experts. Joining me this morning is Dr. Dee Roach and Jennifer Hale. Jennifer, what should someone do if they have had close contact with someone who has COVID-19? And can you also define what would be considered close contact?
If you have been in contact with someone that has COVID-19, there are a few things that you can do. One, once you get that information, you need to make sure you're staying at home and quarantining at home. You can monitor your symptoms from home. The CDC recommends 14 days of quarantining. If symptoms start to develop, you can definitely call the clinic or call us at our hotline. The number is 728-3431, extension 7070, and you can get some more information there. If you call the hotline, you can expect someone to answer, or if we don't answer, leave a message and we'll call you back. They will ask you a series of questions, including your name and some personal information, and then ask the screening questions. And the screening questions are basically, what symptoms are you having? And we go through a list of them. Based on those answers, if you're having any of the symptoms, we will take that information to your provider, if you have a provider here at our facility, and we will ask them, would you like to see them in the specialty clinic for a sick visit, or do we want to do drive-through testing and go ahead and swab them based on the symptoms? Or are you stable enough to continue monitoring at home? Maybe you're not having any symptoms, or maybe just one or two, and just monitor yourself at home, and then go from there. And a lot of times we'll do that, and we'll say, just see how you feel over the next few days, and then give us a call back if anything continues or worsens. If you're in close contact with somebody, that would mean that you're in close proximity, less than 6 feet, for a prolonged period of time. And that could be with or without a facial covering. Maybe it's a family member, maybe it's somebody that you work with and they were in an office space with you for a period of time. But we will be asking these questions if you call in and want to know more, like, what should I do? We will also be asking, what day was your exposure and how long has it been since your exposure? So just be prepared to answer a few questions for us, and be patient. We will definitely get back with you.
Thank you.
Thank you.
So that number, if you have any questions or concerns, is 728-3431, extension 7070. Dr. Roach, can you explain why we are seeing an increase in COVID numbers, not only locally, but also nationwide?
We are seeing, obviously, an increase in number of confirmed COVID cases locally, statewide, and across our nation. And I think it's inevitable that we see this as we open up our economy again. People are getting out more in public, shopping, more social interactions with family and friends. And it just stands to reason, and was expected and inevitable, that we would see an increase in the number of cases. Here locally, we have had an increase just in the last couple of days. This increase represents a population of people that were confined to a very small family gathering, and want to reassure everybody that this does not, in fact, represent a widespread outbreak within our community. I think we've done a really good job thus far in our community maintaining social distancing and wearing our protective equipment appropriately, and we've been very fortunate up to now maintaining and controlling its transmission fairly well. So again, the increase in number of cases, I think, is inevitable. On a state level, I do know that 4 counties in Texas now have actually closed their hospitals to elective surgeries in order to accommodate the increasing number of inpatients admitted to those hospitals. Bexar County, Travis County, Harris County, and Dallas County have, by governor's order, closed their elective surgeries again. So again, it's unfortunate, but pretty much anticipated and expected that we would see an increase. And so the take-home lesson, obviously, is to hold yourself accountable individually and collectively throughout the community. Wear your mask if you're going to be in public. I know we've gotten a little bit lax with that as we saw the numbers declining. And so be diligent about wearing your mask. Be aware of spacing between yourself and other people, and continue to do all the things that we've talked about in the past in order to mitigate your chances of getting the disease, which includes making sure you get plenty of rest, eat healthy diet, drink plenty of fluids, and of course avoid circumstances that you know you might potentially be exposed to the infection.
Thank you. And thank you for joining us this morning for Ask the Experts. Remember, questions can be submitted on Facebook in the comments section, or can also be submitted by emailing jnstone@mitchellcountyhospital.com.